The outbreak of the coronavirus has focused the public on access to quick, effective, and affordable medical care. Right now, there are some barriers in place that prevent that goal from being achieved, barriers that state officials right here in North Carolina could, and in some cases are, actually eliminating. Jordan Roberts is healthcare policy analyst with the John Locke Foundation. He's been looking into all of these aspects as we deal with the coronavirus. He joins us now with some recommendations. Jordan, welcome back to the show.
Thanks for having me.
One thing that has struck me is the issue of, people wanting to practice social distancing, stay inside their homes if they're having some sort of symptoms, but people also want to have access to a nurse or a doctor. That has really brought the spotlight onto something you've written about for many, many, many months. That is telemedicine.
That's right. Yeah. So, I just want to say one thing first, just a special thank you to all the people in the healthcare system that are working tirelessly to, deal with this impending crisis. So just want to give a shout out to all of them because it couldn't be done without them. But yes, telemedicine, we've talked a lot about it. It's becoming more and more commonly used, and especially with a case, virus like this that's very contagious, and it's, we don't really have a lot of idea of where it's spreading to and where cases are coming from. So a lot of the recommendations have been to distance yourself socially from people. That means, minimizing as much contact as to not spread this disease, because even though you might not have symptoms, you might not be affected, you could spread it to other people who may. So telemedicine has been recommended by a lot of the top public health officials as one way to, limit the amount of contact that someone may have. And then, what it does is it supplements, the normal routine of care by, if someone needs a diagnosis, they can, use a video conferencing to get more information that could, better inform their decision of whether I truly need to go to the urgent care or whether I can stay home and isolate myself. So, it just helps, people inform their decisions better, and it's in line with all the public health recommendations of distancing.
It wasn't too long ago that, at least for me, the thought of using my smartphone or my laptop computer to access medical advice or medical care was, I had never thought of that, Jordan,
right.
But this thing has really advanced a lot.
Absolutely.
And in a way, the fact that we're having this crisis of the coronavirus really has made people understand that this can have a really positive impact. And help people, that it doesn't just need to be an innovation that we use as a last resort, but this
right.
could be a first resort.
Yeah, exactly. We're trying to, flesh out all the diagnosed cases and when people actually need to go get tested and get treatment. So telemedicine can really help us by better allocating the resources and directing people better information to make their decision on what to do here.
But here's the problem. Evidently, because of licensure rules, we're not able at this point to access any doctor, any nurse that we would like to see. Tell us about that.
That's right. So current regulations in North Carolina right now stipulate that if you are a patient accessing care through telemedicine, that doctor that you see has to be licensed in North Carolina. And so we know there's plenty of doctors, all well-qualified, highly trained doctors all around the country right now that are willing to, offer their diagnosis and services through telemedicine means, but we can't do that in North Carolina right now. So that's one of the recommendations we see, to just increase the access to diagnosis and information from well-qualified doctors. We can waive these regulations to allow people in North Carolina to see someone that doesn't have a North Carolina license, because once again, just when you cross a state barrier doesn't mean the quality of medical care goes down anymore. And we should just open this up to allow as many people to assist in this pandemic as possible. And so CVS Minute Clinic offers a $59 video visit to one of their licensed physicians or nurse practitioners, but that service isn't available here in North Carolina. And this is just one of the ways we see to help people access the healthcare system now, very affordable pricing, and get information that can help them better make this decision.
And as more people are diagnosed and we're seeing closures, et cetera, at least at the time that you and I are speaking, we're still at the point where we're seeing increasing numbers of cases across the country and across the world. It is putting an especially difficult burden on medical professionals. I'm so
That's right.
glad you gave them the shout out, because this is one of those times where something that we just take for granted really
Exactly.
comes into the spotlight as being essential. So, Jordan, how do we make sure that we have enough access to care and affordable care? Particularly if you look at some of the hospitals, they have a limited number of doctors, a limited number of surgery centers or hospital beds, etc. And the state of North Carolina is realizing that this is a question as well. Tell us what the issue is.
Right. So in North Carolina, we're a certificate of need state, meaning in order to expand beds or expand a facility, buy something new, you usually need permission from the government. So in something like this, where we have a virus spreading and cases are going to come up suddenly, we might there might be a case where a hospital needs to make quick decisions on transforming beds and to treat these folks, or increasing beds, or just making quick decisions on the ground based on what's happening in front of them. And these certificate of need laws would get in the way, because anything above a 10% increase in your beds, you would have to get permission from the state from. But last night we saw Health and Human Services Secretary Mandy Cohen talked about that they're working with the state to get these laws waived, so that if a hospital did need to increase their beds by more than 10%, they would be able to do that without spending resources getting permission from the state. So we're happy to see that that's happened. Obviously, here at the Locke Foundation, we think certificate of need laws should be repealed. And in a situation like this, it kind of highlights that reason that we should trust the medical providers, the private actors on the ground to make these decisions based on what they're seeing, as opposed to someone in Raleigh. So we're glad to see that, because we just want to make sure that these providers and hospitals are able to treat these patients however they see fit, no matter what situation might come up in front of them.
Once we have this virus contained and taken care of, and we get through the immediate issue here, and we start looking back, and let's hope that that's very, very soon, of
Agreed.
course. But once we start looking back, it could be a really interesting light bulb moment, a lessons learned moment, as we
Sure.
look at those barriers and really the different things that we can do here at the state level, not waiting for the federal government or relying on the federal government in terms of rules and regulations, where we can actually do things. And if it ends up helping people in a crisis situation, maybe we can all come to the agreement that we should just leave it this way. Let those people on the ground make those decisions as they need to.
Right. And we talk about certificate of need laws and license reciprocity, recognizing out-of-state licenses to come in and treat North Carolina patients in a time of crisis and emergency. And, I've written about this before. If we trust them in a time of emergency, why wouldn't we trust them, other times? And, these are licensed, well-qualified physicians in good standing. And so, just to increase access and just to give as much power to the private actors, the individuals making these decisions on the ground, we think is, the right direction to go.
Well, Jordan, you've been doing some really interesting writing on this as we have seen this virus situation grow. And folks, you can read all of his work at carolinajournal.com and also johnlocke.org, the different aspects of medical care, affordability, access, and things like that. And Jordan, thanks so much for joining us to talk about all of this.
Yep, no problem. Thanks for having me.